Today we are going to learn salivary scintigraphy, and here is the presentation for the salivary scintigraphy protocol. So here are some indications listed, like Sjogren's syndrome, to evaluate the salivary gland function in the patient suspected of having this autoimmune disorder, which often leads to dry mouth and eyes. Xerostomia, that is dry mouth, to investigate the cause of dry mouth, which can result from various conditions including radiation therapy for head and neck cancers. Pliodentitis, to diagnose the inflammation of the salivary glands, which can be due to infectious or autoimmune diseases. Lithiasis, to detect the salivary gland stones that can block the ducts and cause the pain and the swelling. Salivary gland tumors, to assess the functional status of the glands in the presence of the tumors. Post-radiation therapy assessment, to evaluate the impact of the radiation therapy on the salivary gland functions, particularly in the patients treated for the head and neck cancers. Then pre and post surgical evaluation, to assess salivary gland function before and after surgical intervention. Salivary scintigraphy is a non-invasive, easy to perform, and provides both quantitative and the qualitative information about the salivary gland function. Salivary gland scan protocol: radiopharmaceutical, technetium-99 pertechnetate is administered intravenously. Then there is no specific patient preparation requirement. The only thing we have to ensure that the patient has not taken any potassium iodide or perchlorate within the 48 hours of proceeding for the scan. Imaging device will be the low resolution, high resolution gamma camera. The imaging procedure, the steps include 5 steps. First is the full syringe, normally taken for 10 seconds and 128 matrix, followed by injection to the patient, and then empty syringe for the same acquisition time and matrix. The dynamic acquisition have 3 options, like 30 seconds, 30 frames for each frame of 1 minute, or the second option is 15 frames at 2 minutes per frame, and third option is 45 frames at 1 minute per frame. Matrix 128, patient is positioned supine with neck extended and anterior images are captured. The stimulation is given as a lemon juice at the midpoint of the acquisition, that comes around at the 15 to 16 minutes. Saturated gauze with the lemon juice placed between the cheek and the gums on both sides, and then leave the gauze for 5 minutes and then remove. Then post stimulation imaging, continue dynamic acquisition for the remaining frames after the lemon juice stimulation is given. The next step comes as a data analysis on the workstation. So we have to draw the ROIs around the parotid and submandibular glands, and then compare the pre and post stimulation counts to assess the salivary gland function. For the interpretation of the quantitative data, like it could be a normal or the abnormal. And normal function is where there is a drastic decrease in the activity from the parotid and submandibular. If the activity is retained in the glands, it is indicating potentially a dysfunction. This protocol ensures the comprehensive assessment of the salivary gland function, leveraging the stimulation effect of the lemon juice to differentiate between the normal and abnormal gland activity. These are the, after processing we get this type of images and quantitative information, left and right, parotid glands and submandibular. You will get the graphs for the submandibular and the parotid. Here you can see the graph, vertical line shows where the stimulation was given, and the decrease in the activity shows the clearance of the activity from the glands. This presentation also includes the software file which we are going to use for the processing, that is Salivary 2. and this is Xeleris Workstation.
So I have a doubt that whatever scan protocols, can we go to that slide, the scan protocol slide?
Scan protocol, yeah, this
so
one.
Only the frame rate options which are given, they only will be processed, or any other frame rate also can be processed?
So yeah, so the frame you have to choose so that it is a multiple of 15 seconds, and the time is the multiplication of 15 seconds. If it is multiply of 15 seconds, the software can reframe it to 1 minute and 2 minutes. So you can choose any one of these, it will be processed.
Otherwise it won't process.
Yeah, if it is the time frame is multiple of 15 seconds, it will process any frame rate. But these are the most frequently which is currently used in the nuclear medicine departments.
Okay. So now can we have a look how the data should be processed on the Xeleris software?
Yes. So this is Xeleris 5, which is the latest version. So Xeleris 5 is a dual monitor workstation where the data can be selected on from the all applications, and we have this salivary scan data where we can see the full syringe, then dynamic scan, and then empty syringe. So we need to select all the series of the data and go to the all application. Under the user applications, we have a Salivary application here. Once you single click, it comes to the active area, and click again. You will see the dynamic images displayed, and these are the summed images. Then it is asking us to draw the right parotid gland on the summed image. So this is the summed image, and this side is the right parotid and this side is the left. So we have to just draw the ROI like this. And then click proceed, and similarly for the left parotid. Again click proceed, and then the submandibular gland. Click proceed, draw the left submandibular ROI. So this one is the left side. Alright, then it is asking click proceed and draw the background ROI. You have to draw the background like this. And click final proceed. Now adjust the cursor to the time of administration of the shallow gauge, and you can see this graph. Upper graph is for the parotid glands and these lower graphs are for the submandibular glands. So where is the peak, you have to just position this vertical line at the peak. That represents the maximum uptake, and then click proceed. Now adjust the second cursor to the nadir of the cause, that is where you can see the minimum, that is already correctly positions. Click proceed. Now you will get the automatic calculated values for the right parotid, left parotid, right submandibular and left submandibular glands. The quantitative values are the percentage uptake, relative uptake, and the EF or the clearance from the glands. So here you can see the values. These are the absolute measurements are the calculated from the pre-syringe and post-syringe, and this side the relative uptake is the relative from left to right values, and these are the negative values here indicates no clearance, like this graph, that is the left parotid, you can see it's not decreasing, it's going up. So in these cases you will see the negative values here. Is it clear? Any doubt? Any questions?
So how then printing and all, how can you do that?
So for the printing we have a option here. For example, if you want to give a black and white pictures on the paper, then we have a color option here. We can convert to this to linear view and adjust the intensity using this slider. Once you have done this image processing, here on the top there is a printing tool. Click on the more option. You can see different options for the printing format. So mostly here you have to always look for the color mode you are printing. So in this case we have to choose the inverse because we want a white background. And from the header you can choose whether you want a screen header or you have your hospital format with the logo and all. Then you can select the top option. The hospital header will come on the top. And for example, we'll take a screen capture. Here we have to select the database study 1024 color option. Once you click, then it will ask you to save with a specific name you can give. For example, the results, and click save. Now on the left screen you can see the screen is captured, which is the result page. And if you want to view this, just simply click on load to new, and this is the example how you can get the images.
Thank you so much.
Thank you.